All right, everybody, welcome to our next session of ACLS preparation, which is primarily we're going to focus on bradycardia and the heart blocks. Okay, so bradycardia is fairly straightforward in terms of recognition on the monitor. It's almost always going to be what's called sinus bradycardia. However, for the written test portion, you're going to have to know and recognize the different heart blocks. The heart blocks you'll see is in your course manual. They'll go over the different types. Type 1, type 2, first degree, second degree type 1, second degree type 2, and then third degree heart block. Okay? But what we'll do today is first we'll talk about bradycardia, go over the algorithm a bit, talk about the medications, a little bit about the electrical treatments, and then we'll go over some rhythm recognition for heart blocks. And then in terms of your quiz, it's going to be kind of putting it all together. So you're going to have to be able to recognize some tachycardia, some bradycardia, identify some rhythms, identify the treatments, know the electrical doses, not the doses, but the electrical treatments, and so on. So it's kind of a putting it all together up to this point. Hopefully you've been keeping up with the different videos and classes that we've been going over. So let's go ahead and get started, okay? So first, let's talk about bradycardia. We'll say Brady, okay? And so if you recall, bradycardia has a heart rate of less than 50 beats per minute when we're talking about ACLS. For other clinical purposes, you might think that, oh, the heart rate is less than 60 beats a minute. ACLS purposes, the symptomatic bradycardias are going to be less than 50, and that makes it easier for you to identify it during the mega code and also during your written test. Now, when you're doing your testing, you're going to have to be able to decide, is this person symptomatic or asymptomatic? Are they unstable or are they stable? And we talked before about the signs and symptoms of instability. So that would be altered mental status, confusion, pale, diaphoretic, ischemic chest discomfort, hypotension, those sorts of things. So if you have yourself a patient who is experiencing, ischemic chest discomfort, he's pale, he's confused, his blood pressure is 70/30, and his heart rate is 32 beats a minute, symptomatic bradycardia. Other monitor strip, you have your P wave, and then your QRS, and yourself your T wave. And then there's going to be a long pause, another P wave, QRS, T wave. Okay? And if you remember trying to identify on the strip on a written test, if it's bradycardia, kind of knowing what the rate is, you remember you have your box method. You count the number of boxes between this QRS and the following QRS. Okay? And what is the box method? What are the numbers for the box method? The first one is 300, right? And then 150, and then 100, 75, 60, 50 or 53, right? I think the guy on the video said 53. But you could just say 50, and then what's the next one, like 40 or something like that? Or 40. So it's like 1, 2, 3, 4, 5, 6. So if you're counting and it's like, you don't even have to memorize those numbers if you want. If you just remember it's like 6 or 7 boxes between the QRSs, it's bradycardia, it's too slow. So heart rate in this case is maybe about 40 beats a minute right here. Now, when we talk about this particular rhythm, we talk about sinus bradycardia. Sinus bradycardia essentially means there's no heart block. There's no blockage between the atria and the ventricles. There's nothing that's impeding the electrical impulse from the atria to the ventricles. And so sinus rhythm generally means there's a P wave associated with every QRS. The P wave, and you have your P and your QRS. The P wave in lead 2 is upright, it's consistent, it's within this PR interval right here. The PR starts at the beginning of the P wave and it goes to the QRS complex. So 0.2 seconds. And that P wave is associated with every QRS complex. So that's your sinus bradycardia. It just means the heart is exceptionally slow, but there's no blockage with that. Okay. So you're in your mega code or you're on your written test and you see this person has sinus bradycardia that's symptomatic based on the signs and symptoms. What is the first treatment you want to give? Anybody remembers from the audience?
Sorry.
Pull out your card if you like.
I know, I like the cards.
The nice thing about ACLS is it's an open book test. So as long as you have your algorithms and you know where things are, you're going to do just fine.
Atropine?
Atropine, that's right. So what's the dose of atropine that you want to give?
0.5 milligrams bolus.
So 0.5 milligrams IV bolus.
IV bolus.
And then what's the frequency?
Every 3 to 5 minutes.
3 to 5 minutes, okay. So we talked in our ACLS class last week about, well, how long are you actually going to wait before you want to, maybe think about going to transcutaneous pacing, because 3 to 5 minutes is a long time, and so that depends on how stable they are. If they're you give them the atropine and they're just not responding, they're sick, their blood pressure is low, you might want to go quicker to start doing the transcutaneous pacing, as opposed to somebody whose blood pressure starts to get better, you start to feel better, and that sort of thing. So that's kind of where the clinical aspect comes into play. Ultimately, of course, if you have a cardiologist to guide you, that would be supreme. But in our case here in this clinic, that's not a possibility. And of course, you have to be prepared as well if there is a delay in the ambulance services coming in and taking your patient off to the ER. So these are all why it's important to know these algorithms and know what to do, when to do it. All right, so that's sinus bradycardia. Now, when we talk about the blocks, you're going to have to be able to recognize, remember, and identify the 4 different types of heart block for the sake of the ACLS test. Okay? So, your first block is your first degree. Next one is a second degree, type 1, second degree, type 2, and then your third degree. Okay? So we're going to go over that here in the next video lecture. Let me just pause the tape for a second. Not that it's a tape. We haven't had tape since the 1980s, right? Let me stop the recorder here for a second, and then we'll proceed on to the next lecture. Stand by, we'll be right back.